We have a product primarily at the moment called DySIS. It's a dynamic spectral imaging system to help in the detection of cervical cancer. So when a patient has a smear test, she then gets referred, if she has an abnormal test, for a colposcopy. And colposcopy is a practice that's been done since about 1924 and hasn't really changed. The trouble with it is it hasn't got a very high sensitivity and it's a very subjective test. So it depends on the doctor's experience and training, etc., as to how good he is at colposcopy. But essentially what they do is they look down a colposcope, and it literally is optics. They look down and it just magnifies the patient's cervix. Then apply a bit of acetic acid. Now, acetic acid, when applied to the cervix, if there is abnormal tissue, it goes white. And depending on how white it goes and for how long, is to the extent of the abnormality or the neoplasia on the tissue. The really white areas will be cervical cancer or high-grade disease. So what DySIS does is increases the sensitivity of the test and makes it less subjective, because it's going to look at the same thing every time. So still acetic acid is used, and we've got our spectral imaging system uses high definition video to capture pictures over a 3-minute period, therefore measuring the whitening. Takes all those pictures in, puts them through the algorithm in the computer, and then produces a map over the top of the cervix, which is a coloured map, a little bit like a weather map, and then it shows different colours depending on the state of the tissue of the cervix, which then guides the doctor to see where those areas of abnormality are. They can then take a biopsy and treat it in exactly the same way as they would. We're looking to develop products in other areas of the body, head and neck cancer, those sort of areas. So that's our main focus at the moment, obviously apart from building the business with DySIS.
Where do you see the company in 5-10 years?
Well, we're currently engaged in trying to enter other parts of the world, obviously, so our big next goal is to go into the United States. We're hopefully going to gain FDA approval very soon, which will mean over the next 2 or 3 years we will build the business in that direction. So that will then open up, once you have FDA approval, you can then go into other areas of the Far East, obviously Japan, China, are big markets. We're looking to enter India early part of next year. I'm going to the All India Obs and Gynae Congress in Hyderabad. So those areas are really sort of areas we're trying to go into. At the same time, as you said, trying to develop other products. So building the company from a product point of view and obviously from a geographic point of view as well. So, we would like to think in about 5 or 6 years' time we're going to be leaders in detection of certainly cervical cancer, but obviously cancers in other areas of the body as well.